Today we have discussed the third part of respiratory system. It was the third day, right? We started from, okay, I'll explain something about again, because it is worth repeating. We have tracheobronchial angle. For right side we have 25 degree and for left side we have 45, right? This main bronchus is having more diameter and shorter. Left side is narrower and longer, about 5 centimeter. And obviously right lung and left lung. Right lung, what is the weight of the right lung? 700. Left lung? 600. How many lobes present in the right lung? 10 lobes. In the left lung? 2. How many fissures present in the right lung? 2 fissures. One is horizontal, one is oblique. How many fissures present in the left lung? One horizontal or oblique? Oblique. Okay, how many segments present in the right lung? 10. In left lung? 10. Okay, in the right lung, as I mentioned yesterday also these numbers, according to these numbers we have tertiary bronchus or segmental bronchi. Every segment is having separate bronchus and separate arterial supply, separate venous drainage, separate lymph nodes. Everything is separate in segment. So it is helpful for the surgeon if someone is having any kind of pathology in one segment, this infection will not spread to another segment. So you can remove whole segment from the lung. But except 2 pathologies. What are those? Number 1 is cancer, second is tuberculosis. These 2 disorders will love to spread from one segment to another, to third, fourth, and all lung will be involved by these. Okay. Then after that, how many surfaces of the lungs? We have 3 surfaces. Number 1 is costal surface, diaphragmatic surface, mediastinal surface. How many borders of the lung do we have? 3. Interior border, inferior border, posterior border. Apex of the lung present over here. It is present 3 centimeter above the first face or 1.5 centimeter above the medial 1/3 of the clavicle. Most importantly, not only the lung, most importantly parietal pleura. Parietal pleura, most importantly. Then base of the lung is just lying on the dome-shaped diaphragm. Then we have discussed about the hilum, like with every like kidney and spleen, every organ is having hilum where there is any kind of entry or exit of the structure. Suppose this is any organ and this is the entry or exit point, na, your door. So this is the hilum of the lung having entry or exit for 3 ways, for vein, artery and bronchus. This is important to understand and remind 3 structures as well as their position, like V for pulmonary vein, A for pulmonary artery, B for bronchus. They are passing through this hilum. Plus, first of all, most anteriorly we have pulmonary vein. In posterior to that we have pulmonary artery. In posterior most we have bronchus going to the lungs. Then after that we talked about pleura. We have 2 types of pleura, visceral and parietal. Visceral pleura is just like the lungs. It will spread, or size of the visceral pleura will be according to the lung itself. Just like a pia mater I told you. Pia, mother loving, more close to the brain, or all these things. Same is true with the visceral pleura also. It always used to stuck with the lung. Lung के साथ stuck होता है, कोई gap नहीं लगती. Then we have parietal pleura or second most external pleura, having giving the lungs to expand and having a making a cavity between visceral and parietal pleura called pleural cavity, having a serous fluid in order to prevent the collapse of the lung. Okay, during expiration, most importantly. जब दोबारा से हवा निकालेंगे तो ही वो collapse होने का खतरा है ना. So during the expiration of the lung, there are chances of lungs to collapse thanks to fluid present in the pleural cavity. And then we talked about recesses. We have 2 recesses present over there. Most importantly, we have costodiaphragmatic and this mediastinal. And this one is most dependable recess of the lungs. Why most dependable? When someone is having hydrothorax, chylothorax, pneumothorax, pyothorax, the fluid, accumulation of the fluid or air or pus will be entered into this recess. And obviously you have to remove the recess. We have to do recesses.
Yes.
This is the most dependable part. Then due to any stab wound or sharp wound injury, any kind of accumulation of air, water, pus or bile or anything into this pleural cavity, it will enter into this recess and it will stay there. It is bad, and good thing is this, we can remove from this at mid-axillary line eighth intercostal space, you can insert the needle. Obviously, this needle has to pass many structures. Most important first structure is skin. Then obviously we have superficial trachea, then external intercostal muscle, internal intercostal muscle, innermost intercostal muscle, and then parietal pleura. Then you are in the pleural cavity. Then you can pull the plunge out to pull the water or air or pus, whatever has been accumulated in the recess. You can remove that. That is thoracocentesis. And this is innervation of the parietal pleura, phrenic nerve. Root value is C3, C4 and C5. This is the nerve which is innervating your diaphragm. If this nerve is not working in your body, you cannot live, because when there is no phrenic nerve, there is no innervation to your diaphragm, you will die with respiratory arrest. Because diaphragm is the most important muscle of respiration. Diaphragm is also called muscle of weight lifting. When you do deadlifts, deadlifts.
Yes, sir.
So you used to use this diaphragm muscle. This is also called muscle for maintaining the pressure. जब आप washroom में हो, unfortunately, or you have shortage of time and you want to finish the toilet working as soon as possible, you used to give pressure on the diaphragm, increasing the abdominal pressure, thanks to your diaphragm muscle. If that muscle is not working or this phrenic nerve is having problem, your life is not normal. Then intercostal nerve. These both nerves are innervating this parietal pleura, which is having the pain receptor. But visceral pleura, which gets innervation by sympathetic nervous system. T2, T3, T4 and T5. This is the innervation of visceral pleura. Don't forget this thing also. You may explain T3. But it do not have pain receptors. But referred pain, because phrenic nerve is innervating the parietal pleura, due to this pleuritis. What is pleuritis? Pleura is the inflammation of the pleura linings. Then pain may spread to your neck and shoulders. But I told you one disease that will spread to your right shoulder. Pathology of gallbladder. If someone is having referred pain to the left shoulder only, that will be pathology of spleen. Splenic rupture. Most vulnerable organ to get rupture due to any kind of accident. Then I talked about cancer, uncontrolled, unregulated growth of the cells, which will spread from one segment to another segment. So after that, Adam's apple we have discussed, most prominent males. This is nothing, just a projection or outgrowth of the thyroid cartilage. As I mentioned last time also, the different cartilages. Thyroid cartilage and cricoid cartilage, uniform, corniculate. These cartilages are present in your larynx. The little area is another name of kissoid plexus, responsible for interior nosebleed or epistaxis, having 5 arteries: anterior thyroidal artery, posterior thyroidal artery, sphenopalatine artery, greater palatine artery, and superior labial artery. These are the branches of internal carotid arteries and external carotid arteries.